Hello my fellow freedom builders and welcome back to the channel. In today's video here, a late Sunday evening here in Denmark, I'll make a quick video about this new Remdesivir news that have come out showing that the drug from Gilead that everybody had hoped would be some sort of truly revolutionizing treatment against the virus, it has failed, at least in one of the ways where we have hoped it could help us, meaning in the way where it could reduce the number of deaths or the death percentage from the people getting the virus. So let's have a look at what is actually happening. Remdesivir is a drug that has been tested and that showed some preliminary good results coming out of the company Gilead. And when we look at the price here, we could see that in April and May, Gilead Science here was one of the stocks that was hyped a bit up in the hope for this new fantastic drug, and it took a quick turn up and went up 25 to 30% here. However, when we look just at the technical analysis here around end of July, we got some sell signals, and that shows a bit the danger of pharma and biotech stocks because they are very news sensitive. And even though this one had a downtrend here and I would have been exited from the stock, if it had come out now that the Remdesivir was perfect to treating the virus, then this stock would have jumped up to, I don't know, double price or something like that simply on the news, and I would not have been in it. But it seems like I'm not sure if someone knew something here, or at least the news have been taken out of it, and since the end of July here it has just been going one way, and that is down with 20%, something like that. I have a suspicion that that will go down further in the next week when the market really prices in this news. There was some rumors coming out about it, but this is the news. You can see here an article here from October 16th in Science News. That is really one of the big science papers here. Remdesivir doesn't reduce the COVID-19 deaths and a large WHO trial finds. And that is an international study, so it's not something I have seen already on some, I'm sorry to say, but some crazy websites saying that this is just some democratic, some sort of conspiracy. I've also seen that the WHO should have some sort of grunt against Trump because that he tried to take United States out of WHO. There's simply no evidence for that. This is a very, very broad study. The WHO, they have this trial which combined data from 405 hospitals in 30 countries, randomly assigned more than 11,000 people hospitalized with the virus here. So they were to receive one of 4 drugs, and these drugs were, of course, the Remdesivir, but it was also this anti-malaria drug that Donald Trump thought it was a great idea to take, the hydroxychloroquine, and then an anti-HIV drug, and something called the interferon beta 1A. I'm not 100% certain what these are, but what is most important here is that the Remdesivir was the one that people had the biggest hope towards. And it seems here that none of the drugs showed any benefit in reducing deaths. So I'm sorry to say, but the Remdesivir or any of the other drugs have simply not proven any functionality towards preventing any virus deaths. So in this article, and I'll of course link to all the articles I found about it in the comment section below, but there is some preliminary data showing that Remdesivir has been shown to shave 4 days off the hospital stays, meaning that when a patient comes in with the virus, they get treated with Remdesivir, and in the first trial run, it actually showed that it would cut 4 days off. The average time in hospital is 15 days with the virus, but this Remdesivir treatment allegedly cut 4 days off that. But that was a much smaller setup, and this is from April and May. and this has not been tested in the new setup. So what is important here is that it might still be that remdesivir cuts the days off the hospitalization time, but this huge setup here was only to test if any of these drugs could minimize the number of deaths. So now they need to dig deeper into the data and find out if there might be some indication that it can reduce the time in the hospital. Because if it can, then it might actually prevent some deaths anyhow, because many of the deaths, or at least some of the deaths around the world, happens in hospitals where there's simply too much run on the hospital and on the ventilators, and because of lack of equipment, then some people die from that. And if we can reduce the number of days in the hospitalization, then we might also do so that the hospitals have more equipment available when patients get in. But this is just speculation still. There's simply no complete evidence about this. In the end of the article here, we can also see that some experts actually think that remdesivir might be okay to give to some of the patients because it might be effective towards patients that just recently got the virus. They are saying that maybe one of the reasons why remdesivir didn't work was that it was given to people at a very late state in the illness. They are, but giving remdesivir to sick people earlier might help. Experts say. Boucher and colleagues are part of a study testing the drug in people who are newly diagnosed. So a lot of testing still goes on here, but this big hope that remdesivir could really save us and help us towards a lot of the deaths, that simply hasn't come true. Another thing is that remdesivir is quite expensive. It costs between $2,000 and $3,000 per treatment, and it is also very complicated to give. So it is not an easy treatment, but of course, if we could prevent the death, we would gladly pay some money and use some time there. Some of the other articles I will link to is, that's pretty much the same about the remdesivir here. There are some different angles on it. Some of them, and this is just the science paper here saying that remdesivir and interferon fall flat in WHO's mega study. But that is, of course, as I said before, the reason why they fall flat is that they were testing for the reduction in deaths. And here there is absolutely no effect to find. Another good news, if you want some good news from this area, from this little niche, is that Pfizer says that it hopes to seek authorization for its COVID-19 vaccine in mid-November. They're coming out with some numbers here at the end of October. And I was a bit puzzled when I heard that Trump were out saying that the United States would have a vaccine before the election, because there was not really any indication from any of the research areas suggesting this. But I have a feeling that this is what he was referring to, unless of course he was referring to some secret Russian vaccine. I'm not certain about that. But if he took some US data, this might be the data he was referring to, because Pfizer is coming out with some preliminary numbers right now here at the end of October that might suggest that there is some hope for a some sort of authorization, urgency authorization for their vaccine in mid-November. But this is on a wishful basis, you might say. It is filled with hopes too, and the research suggests and so on. So it states here, so let me be clear, assuming positive data. So this is just assuming positive data. Pfizer will apply for emergency authorization use in the US soon, after the safety milestone is achieved in the third week of November. And again, I have heard a lot of conspiracy theories coming out and saying, oh, that was convenient, that was just after the election. But again, this is how it is done. You know that Russia came out and said, yeah, well, we have a vaccine ready, but it was just hardly past the phase 2, meaning that it had only been given to some animals, and to, I think it was 62 patients over 2 months. And this is simply not how to conduct proper research. Now, when a situation like this with the virus is very dire and urgent, you can get some emergency authorization, but you do not go out and rush a vaccine through, because it might end up killing more people than it prevent deaths. So this is not something we want to see. So I'll also link to this below. You can read about this potential vaccine, but just remember that nothing is certain here. But of course, if it comes through, then the Pfizer stock could be a good place to look. But then again, us retail traders, us dumb money, we would probably get in too late, I'm afraid. Also here we have the COVID remdesivir has little or no effect on survival. So there are a lot of articles about this, and many of them are from very, very credible sources. So I'm always trying to find a lot of sources saying or pointing in the same direction before I make my videos here. Also, when we're talking about the vaccine, just remember that, of course, when the vaccine comes out, the stock market will go up. But just still remember that we are somewhere between 7 to 8 billion people in this world. And as I saw a professor saying the other day, is that from we have the vaccine until we are actually immune as a population here in the world, it will take quite a while, because we will need somewhere around 2 to 3 billion doses of this vaccine before we are really starting to get any effect. So we could not just count on everything, every economy opening up from the day we have the core vaccine in our hands. It will have to be produced in billions of doses, and that takes time even in today's advanced society. So this professor said that 1.5 to 2 years was to be expected before we had really covered the population. Of course, the most urgent use of the vaccine will be on old people, on people with some other illnesses where they are exposed extraordinary much to the virus here. So there will be some people getting the first production of vaccines, but you and I, if we are healthy, relatively young people, then it will take quite a while before we are to see any effect of the vaccine. Just so that you realize that, of course, the stock market will go up the day we can proclaim that now we have the vaccine. But from that point until it will actually have an effect on the overall economy, it can take quite a while, and we will need a lot of social distancing and masks and gloves and hand sanitizers and all that for quite a while yet, I'm afraid. Sorry to say. I just thought I would give you a little Sunday update here on the vaccine, on the remdesivir and the other tests from WHO. I hope it will not depress you too much on this wonderful Sunday evening. Take care of yourself and your money out there, and I hope to be back with some happy news Monday. By the way, I almost forgot to say, I am introducing a new series tomorrow called Mining Monday, and I guess you can hear from the name that it is all about mining, and I hope to have this up every single Monday from now on, where I'll give you all the mining news on gold, silver, copper, uranium, so on and so forth. And yeah, I'm looking forward to that, so tune in tomorrow. Talk to you again soon. Bye for now.